Hi, everyone, and welcome to the show. Today's guest brings a real blend of clinical tips and technical vision to the conversation. I'm joined by Dr. Rashid Taher, a former retinal surgeon who has transitioned from the operating room to the innovation lab, leading efforts to deep AI-driven solutions for accessible and early-stage eye care. He's the founder of EyeCheq, an AI-powered platform designed to detect vision-threatening conditions. Dr. Rashid, it's a pleasure to have you here. Thank you for joining me.
Thank you, Stacy, for having me. I'm looking forward to our conversation today.
Okay, that's great. So to start things off, your journey is quite unique. You spent years in clinical practice, and now you are building tech that could scale access to care on a whole new level. So, what inspired you transition from hands-on retinal surgeon to developing AI solution like EyeCheq?
Yes.
And how has your clinical background shaped the way that these technologies are designed and implemented?
Well, thank you for that question. I think it's a very important one, and it's not only applicable to ophthalmology, but I think in general, medicine in this country. Patients, when I was seeing patients on a full-time basis, I was seeing 80, 90 patients a day, and without fail, every day I was seeing patients with end-stage blinding disease. And in today's day and age, over 90% of blindness is preventable if caught early enough. So really, it was very important for me as a surgeon to educate my patients and let them know that screening is very important. Unfortunately, a lot of times patients, when they're symptomatic, particularly when it comes to their eyes, it's often too late when they come to see a retina specialist. When they're symptomatic, there's usually advanced pathology that unfortunately cannot be reversed. So we really wanted to create a point of care solution where we can screen patients at locations that they frequent much more often than the eye doctor's office. As mentioned, by the time they go to the eye doctors, unfortunately, I had to break a lot of bad news to people, hold their hands and, give them a tissue because of their crying as a result of not getting the news they wanted. But with the EyeCheq, we really wanted to create that solution where we can scale our reach. It's really addressing a clinical issue, but also a systemic issue within our healthcare society. There's, nothing really difficult or challenging with an experienced ophthalmologist to diagnose disease early. The problem is that patients are just not aware of their conditions and weren't coming in on an annual basis or on a frequent basis. So we're excited to share our journey with you about EyeCheq, and thank you for asking that question.
Okay, that's such an eye-open reality. Like, it's no pun intended. It's honestly, so heartbreaking to think that so many of those cases could have been, prevented with earlier detection. And when you are seeing, for example, like the 18 to 90 patients a day, and it's a clear sign that the current system just isn't built for proactive care at scale. So let's bring us to the core of what EyeCheq is trying to solve. So when it comes to early detection, particularly for the disease like a diabetic retinopathy or macular degeneration. So how does AI enhance both the accuracy and efficiency of screening compared to traditional method?
I think that's an excellent question, and AI has become really an essential part of our vocabulary, not just in medicine, but across every discipline. But specifically with medicine, AI is not really intended to copy what clinicians do. It really just enhances our ability to help the patients. So at EyeCheq, we have a fleet of AI engineers and physicians that are working hand in hand. We use our training models, and we ingest thousands and thousands of images of people's retinas, and then each image is annotated by expert clinicians, which helps us then improve the sensitivity and specificity of our ability to detect diseases in patients' eyes. So in clinical practice, obviously, human interpretation is subject to variation. You have 5 doctors, they can have 5 different interpretations perhaps. And there's also, of course, you have to worry about fatigue. There's always a bias, and definitely people with different varying levels of experience impart necessarily different diagnoses. AI is very different, and it's very unique as a tool for the physicians. AI doesn't get tired. AI doesn't blink. AI can detect subtle issues like microaneurysms or retinal thickening or things that may go very unnoticed, even by a trained clinician. So our ability to pick up these little slight subtleties within the eyes earlier can help us hopefully prevent vision-threatening conditions. And compared to traditional screening models, using EyeCheq in our sort of platform, we eliminate the bottleneck. There's no need now to schedule eye exams weeks out, no need to take time off from work, there's no dilation necessary, and there's no dependency on family members or staff members to do the testing. You can do it on your own time. So I think the importance of AI really is going to help us create point of care solutions that will bring patients into the clinical care setting earlier. So I don't see this at all as being competitive to eye care providers. In fact, we think we're going to grow the market for eye care providers by screening more patients, identifying diseases earlier, and then getting them into the right care channels appropriately.
Wow, yes, that's really helpful distinction, and I really agree with that. AI isn't meant to replace clinicians, but to amplify what they are capable of doing, especially when it comes to, like the consistency and the scale, and the fact that your team is combining the expertise of both engineers and, the physicians, and really speaks to the level of precision you are building into the system. And that brings us to a challenge that every healthcare providers can relate it to documentation. So from clinical notes to diagnostic records, that process can be time consuming, and at times it's prone to error. So how do EyeCheq help streamline the documentation process for clinicians, and what impact does it have on overall patient care?
Stacy, that's such an important question, because I think undoubtedly you can ask every clinician out there, one of our biggest burdens is the necessity, but the evil of documentation, because obviously it's very time consuming. It takes our attention away from the patient, which is really should be our focus. And sometimes it compromises our ability to effectively communicate with our patients because we're not really speaking to them. We're sitting in front of our computer typing into the EMR system. And I think, with EyeCheq, we really designed our workflow to be a fully autonomous system that doesn't just capture diagnostic grade images, but it also helps the physicians do the legwork. We really wanted to ensure a seamless integration within the workflow, be it in a clinical setting, a laboratory setting, or a retail healthcare setting. They have different needs and different nuances, but certainly we understand that we have to be very unobtrusive and not interrupt the workflow of the physicians. We're trying to make life simpler, not only for the patients, which is our priority, but also to facilitate ease of use for the doctor's offices that are on the receiving end of our reports.
Yes, I think you are absolutely right. It's sometimes, and something we hear again and again from clinicians, documentary is essential, but it always comes a barrier to presence and connection with the patient. So the idea of building a workflow that not only captures diagnostic image, but also reduce the administrative burden is incredibly powerful. So another barrier you've touched on before is access, especially in area where seeing a retina specialist just isn't feasible, right? So how does EyeCheq's autonomous, like you mentioned that the kiosk-based system help improve access to specialized eye care, and particularly in understand or remote, the remote region? And what challenge have you encountered in rolling that out?
I think that's an excellent question. And again, it goes to the lack of providers in many of our counties here in the US. Eye care or general healthcare isn't just about insurance anymore. It's really about proximity to healthcare providers or healthcare delivery systems. The United States, which is, an advanced first world country, the richest country in the world, with the best technology, we still have tens of millions of Americans that are, live tens of miles, if not more, from the closest optometrist or ophthalmologist. 1 in 4 counties in the United States do not have an eye care provider. That's a staggering number. 1 in 4 counties. That's a lot of territory where there are no eye care providers at all. And many of these people that are living in these counties are living and managing chronic conditions like diabetes, hypertension, and all these diseases manifest in the eyes. The eyes are truly the window to the wellness of the body. So it's critically important for these patients to have access to eye care. So EyeCheq was built with these people in mind, these populations in mind, where eye care, there's healthcare deserts. There are no doctors, there are especially no specialists in these areas. So our kiosks are fully autonomous. They require no trained operator. The design of the kiosk was intended for 72-year-old, Medicare Advantage, non-tech native, tech naive person, so that they can go through the experience themselves. The whole experience at the EyeCheq kiosk ranges between 5 to 7 minutes, and you conduct all the tests on your own. So we eliminate the need to have the patients go into the eye doctors for routine care. We do the screening, and then once we identify pathology, we refer them to the appropriate optometry services, because we believe optometry is truly the first line of eye care. They're the primary care providers within the eye care space. So we partnered with some very large organizations within optometry, and we're very excited by those partnerships so that we can extend eye care delivery to those people that have been historically denied access.
Okay. Yeah, it's hearing how EyeCheq is designed to fill those massive care gaps is truly inspiring. But within any engineering technology, especially AI, one of the biggest challenge isn't just to build the tool. It's more about the earning clinicians' trust and ensuring the technology complement their work without overwhelming them. So with that in mind, what have you learned about build trust in AI amongst medical professionals, and what do you think it takes for AI to be truly embraced as a part of clinical decision making rather than just viewed as a black box?
Yeah, I think that's a wonderful question, and I think everybody talks about AI as being a disruptive tool. We don't really need disruption in healthcare. We need enhancement. We need to really identify pain points within healthcare so we can enhance and improve upon those systems. We created this keeping in mind that it's a collaborative process. Everything we're doing is really to first and foremost enhance the patient experience and patient outcomes. But there always has to be humans in the loop. AI should not be a replacement for physicians or technicians. It should really help us enhance that workflow. And collaboration means listening to our customers, listening to our partners in healthcare delivery, be it physicians or be it administrators. It really is understanding what their pain points are and providing customized and catered solutions to enhance their workflow and not disrupt it. We wanted to create a seamless experience, be it in the waiting room of a Quest lab or in a community health center or in a hospital medical office building where there's many patients that are being processed. We wanted this experience to really be as seamless as possible without disrupting our host sites. And again, listening to our partners and collaborating so we can deliver the best possible solutions for them.
Yeah. Well, I really appreciate that perspective, and I think it's perfectly echoes what we believe at CliniScrips as well. AI isn't here to replace the clinicians, but it's here to support them, to enhance workflows, and ultimately to improve patient care without losing the human connection. Dr. Rashid, thank you so much for joining me today and share how EyeCheq is helping lead that vision forward, making intelligent, accessible care a reality. And to our listeners, if you are curious about how AI is transforming documentation and clinical workflows in mental health and beyond, be sure to follow us at CliniScrips for more conversation like this. Until next time.